Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Popliteal fossa. Introduction. Popliteal, Latin hamstring of knee, fossa is a shallow diamond-shaped depression felt best at the back of knee joint, when the joint is semi-flexed. It corresponds to the cubital lossa of the forearm. Surface landmarks. Lateral and medial condyles of femur and tibia can be identified easily on the sides and front of the knee. Head of the fibula is a bony prominence situated just below the posterolateral aspect of the lateral condyle of tibia. Common peroneal nerve can be palpated against the posterolateral aspect of the neck of fibula, medial to the tendon of biceps femoris, by moving the finger from below upwards. Fibular collateral ligament of the knee joint is felt like a rounded cord just above the head of the fibula in a flexed knee. When the knee is flexed against resistance, the hamstrings can be seen and palpated easily right up to their insertion. Medially, the rounded tendon of the semitendinosus lies superficial to the flat tendon of semimembranosus. In front of these tendons there is a groove bounded anteriorly by the tendon of adductor magnus. Laterally, there is the tendon of biceps femoris. In front of this tendon there is a shallow groove bounded anteriorly by the iliotibial tract. Pulsations of the popliteal artery can be felt in the middle of the popliteal fossa by applying deep pressure. In the lower part of popliteal fossa, two heads of the Gosfrucht nemophiles form rounded cushions that merge inferiorly into the calf. Make a horizontal incision across the back of thigh at its junction of upper 2/3 with lower 1/3 and another horizontal incision at the back of leg at its junction of upper 1/3 and lower 1/3, v. 6. Draw a vertical incision joining the midpoints of the two horizontal incisions made, 7. Reflect the skin and fascia on either side. Find the cutaneous nerves, e.g. posterior cutaneous nerve of thigh, posterior division of medial cutaneous nerve, sural communicating nerve and short saphenous vein. Cut and clean the deep fascia. Identify the boundaries and contents of the fossa. Trace the tibial nerve as it courses through the center of the popliteal fossa. Its three delicate articular branches are given O-flow in the upper part of the fossa, cutaneous branch in the middle part and muscular branches in lower part of the fossa. Common peroneal nerve is laying gust medial to the tendon of biceps femoris muscle. Trace its branches. Popliteal vein is deep to the tibial nerve and popliteal artery is the deepest as seen from the back. Trace all the muscular, cutaneous, genicular, and terminal branches of the popliteal artery. Location. The popliteal fossa is a diamond-shaped depression lying behind the knee joint, the lower part of the femur, and the upper part of the tibia. Boundaries. Superiorlaterally, the biceps femoris. In medially, the semitendinosus and the semimembranosus, supplemented by the gracilis, the sartorius, and the adductor magnus. Inferiorlaterally, lateral head of the gastrocnemius supplemented by the plantaris. Inferomedially. Medial head of the gastrocnemius. The roof of the fossa is formed by deep fascia or popliteal fascia. The superficial fascia over the roof contains the small saphenous vein and cutaneous nerves. Three cutaneous nerves, namely, the branches and terminal part of the posterior cutaneous nerve of the thigh, the posterior division of the medial cutaneous nerve of the thigh, and the peroneal or sural communicating nerve. The /or of the popliteal lossa is formed from above downwards by the popliteal surface of the femur. The capsule of the knee joint and the oblique popliteal ligament. See the C-strong popliteal fascia cover and th popliteus muscle. Contents of the fossa: 1. The popliteal artery and its branches. 2. The popliteal vein and its tributaries. 3. The tibial nerve and its branches. 4. The common peroneal nerve and its branches. 5. The posterior cutaneous nerve of the thigh. 6. The genicular branch of the obturator nerve. 7. The popliteal lymph node. 8. The popliteal vessels and the tibial nerve cross the lossa vertically, and are arranged one over the other. The tibial nerve is most superficial, the popliteal vein lies deep or anterior to tibial nerve, and the popliteal artery is deepest of all. The artery is crossed posteriorly by the vein and by the nerve. The relative position of these structures is as follows. In the upper part of the fossa from medial to lateral side. Artery, vein, and nerve AVN, popliteal artery, popliteal vein, tibial nerve, AVN. In the medial part from behind forwards NVA. In the lower part, from medial to lateral side, nerve, vein, and artery. N, V, A. The common peroneal nerve crosses the fossa obliquely from the superior angle to the lateral angle, along the medial border of the biceps femoris, lying in the same superficial plane as the tibial nerve. Popliteal artery. Beginning, course and termination. Popliteal artery is the continuation of the femoral artery. It begins at the opening in the adductor magnus or hiatus magnus, i.e. at the junction of middle 1/3 with the lower 1/3 of thigh. It runs downwards and slightly laterally, to reach the lower border of the popliteus. It terminates at the lower border of popliteus by dividing into the anterior and posterior tibial arteries. Relations. The popliteal artery is the deepest structure in the popliteal fossa. It has the following relations. Anterior or deep to the artery, from above downwards, there are, the popliteal surface of the femur, the back of the knee joint, the fascia covering the popliteus muscle. Posteriorly, spit branch to the tibial nerve. Laterally, biceps femoris and the lateral condyle of the femur in the upper part, plantaris, and the lateral head of the gastrocnemius in the lower part. Medially, semimembranosus and the medial condyle of the femur in the upper part. The lower part of the artery is related to the tibial nerve, the popliteal vein, and the medial head of the gastrocnemius in the lower part. Branches. Several large muscular branches are given off. The upper, 2 or 3, muscular branches supply the adductor magnus and the hamstrings, and terminate by anastomosing with the 4th perforating artery. The lower muscular or sural branches supply the gastrocnemius, the soleus, and the plantaris. Cutaneous branches arise either directly from the popliteal artery, or indirectly from its muscular branches. One cutaneous branch usually accompanies the small saphenous vein. Genicular branches are 5 in number, 2 superior, 2 inferior and 1 middle. The middle genicular artery pierces the oblique popliteal ligament of the knee, and supplies the cruciate ligaments and the synovial membrane of the knee joint. The medial and lateral superior genicular arteries wind round the corresponding sides of the femur immediately above the corresponding condyle, and pass deep to the hamstrings. The medial and lateral inferior genicular arteries wind round the corresponding tibial condyles, and pass deep to the collateral ligaments of the knee. All these arteries reach the front of the knee and take part in forming the anastomosis around the knee. Blood pressure in the lower limb is recorded from the popliteal artery. In coarctation of the aorta, the popliteal pressure is lower than the brachial pressure. Constant pulsations of the popliteal artery against the unyielding tendon of the adductor magnus may cause changes in the vessel wall, leading to narrowing and occlusion of the artery. Sudden occlusion of the artery may cause gangrene up to the knee, but this is usually prevented by the collateral circulation through the profunda femoris artery. The popliteal artery is fixed to the capsule of the knee joint by a fibrous band present just above the femoral condyles. This may be a source of continuous traction or stretching on the artery, causing primary thrombosis of the artery in young subjects. When the popliteal artery is affected by atherosclerosis, the lower part of artery usually remains patent where grafts can be tried. The popliteal artery is more prone to aneurysm than many other arteries of the body. Popliteal vein. It begins at the lower border of the popliteus by the union of veins accompanying the anterior and posterior tibial arteries. It is medial to the popliteal artery in the lower part of the fossa, posterior to the artery in the middle, and posterolateral to it in the upper part of the fossa. The vein continues as the femoral vein at the opening in the adductor magnus. The popliteal vein receives, the small saphenous vein. 1. The veins corresponding to the branches of the popliteal artery. Tibial nerve. Lateral, ventral divisions of ventral rami of L4, L5, S1, S2, S3. Course. This is the larger terminal branch of the sciatic nerve. It lies superficial or posterior to the popliteal vessels. It extends from the superior angle to the inferior angle of the popliteal fossa, crossing the popliteal vessels from lateral to medial side. Branches. 1-3 genicular or articular branches arise in the upper part of the fossa. These are: superior medial genicular nerve lies above the medial condyle of femur, deep to the muscles. Middle genicular nerve pierces the posterior part of the capsule of the knee joint to supply structures in the intercondylar notch of femur. Inferior medial genicular nerve lies along the upper border of popliteus and reaches inferior to the medial condyle of tibia. 2 Cutaneous nerve is called femoris, which originates in the middle of the fossa and leaves it at the inferior angle. It supplies the skin of lower half of back of leg and whole of lateral border of the foot till the tip of little toe. Muscular branches arise in the distal part of the fossa for the lateral and medial heads of gastrocnemius, soleus, plantaris, and popliteus. The nerve to the popliteus crosses the popliteal artery, runs downwards and laterally, winds round the lower border of the popliteus, and supplies it from its deep, anterior, surface. In addition to the popliteus, the nerve also supplies the tibialis posterior, the superior tibia-fibular joint, the tibia, the interosseous membrane, and the inferior tibia-fibular joint. Clinical anatomy. Most of the muscular branches of tibial nerve arise from its lateral side except to medial head of gastrocnemius. So the medial side of the nerve is safe. Damage to tibial nerve causes motor and sensory loss. Motor loss: superficial and deep muscles of calf and intrinsic muscles of sole. Sensory loss: loss of sensation on whole of sole of foot, plantar aspect of digits and nail beds on dorsum of foot. Common peroneal nerve. It is dorsal divisions of ventral rami of L4, L5, S1, S2. Course. This is the smaller terminal branch of the sciatic nerve. It lies in the same superficial plane as the tibial nerve. It extends from the superior angle of the fossa to the lateral angle, along the medial border of the biceps femoris. Continuing downwards and forwards, it winds round the posterolateral aspect of the neck of the fibula, pierces the peroneus longus, and divides into the superficial and deep peroneal nerves. Branches. 1 Cutaneous branches are 2 types. Lateral cutaneous nerve of the calf descends to supply the skin of the upper 2/3 of the lateral side of the leg. Sural communicating nerve arises in the upper part of the fossa. It runs on the posterolateral aspect of calf and joins the sural nerve. 2 Articular branches. Superior lateral genicular nerve accompanies the artery of the same name and lies above the lateral femoral condyle. Inferior lateral genicular nerve also runs with the artery of the same name to the lateral aspect of knee joint above the head of fibula. Recurrent genicular nerve arises where common peroneal nerve divides into superficial and deep peroneal nerves. It ascends anterior to the knee joint and supplies tibialis anterior muscle in addition to the knee joint. Muscular branches do not arise from this nerve. However, it may give a branch to the short head of biceps femoris. Posterior cutaneous nerve of thigh. It is a content of the upper half of the popliteal fossa. It pierces the deep fascia about the middle of the fossa, and supplies the skin up to the middle of the back of the leg. Genicular branch of obturator nerve. This is the continuation of the posterior division of the obturator nerve. It runs on the posterior surface of the popliteal artery, pierces the oblique popliteal ligament, and supplies the capsule of the knee joint. Popliteal lymph nodes. These lie deep to the deep fascia near the termination of the small saphenous vein. They receive afferents from lateral part of sole, both superficial and deep parts of back of leg and knee joint. The efferents end in deep inguinal lymph nodes. Clinical anatomy. The common peroneal nerve can be palpated against the posterolateral side of the neck of the fibula. It may be injured in this area. It is the most frequently injured nerve in the lower limb. This nerve is relatively unprotected. It may get entrapped between the attachments of peroneus longus to the head and shaft of fibula. Patients present foot drop, which is usually painless. There is weakness of dorsiflexion of ankle and of eversion of the foot. Inversion and plantar flexion are normal and ankle jerk is intact. Popliteal lymph nodes get enlarged in infection on lateral side of sole/foot. These are lying along the short saphenous vein. Short saphenous vein pierces deep fascia to drain into popliteal vein. Anastomosis around the knee joint. One anastomosis around the knee joint is a complicated, arterial network situated around the patella and around the lower end of the femur and the upper end of the tibia. The network is divided into a superficial and deep part. 2. The superficial part lies partially in superficial fascia around the patella and partly behind the ligamentum patelli. The deep part lies on the femur and tibial around their adjoining articular surface. 3. It is formed medially and above the condyle. 4. The descending genicular branch of it and its saphenous branch. 5. The superior medial genicular. 6. Medially and below the condyle. A saphenous branch of descending genicular. B. The inferior medial genicular. Laterally, and above condyle, the descending branch of the lateral circumflex femoral. The superior lateral genicular. Laterally and below the condyle. A. The anterior tibial recurrent. B. The inferior lateral genicular posterior tibial recurrent from anterior tibial. Circumflex fibular from posterior tibial. The medial and lateral arteries form longitudinal anastomoses on each side of the patella. The longitudinal anastomoses are interconnected to form transverse anastomoses just above and below the patella and above the tibial tuberosity. 4. The anastomoses supply the bones taking part in forming the knee joint, and the capsule and synovial membrane of the knee joint. Popliteal fossa, upper part, from medial to lateral side AVN. A. Popliteal artery. V. Popliteal vein and tibial nerve. Middle part, from behind forwards NVA and tibial nerve. V. Popliteal vein. A. Popliteal artery. Lower part from medial to lateral side. And tibial nerve. V. Popliteal vein. A. Popliteal artery. Popliteal artery is used for auscultating while measuring blood pressure in lower limb. Short saphenous vein starting from the lateral end of the dorsal venous arch drains into the popliteal vein in the popliteal fossa. Popliteus muscle unlocks the locked knee joint before it is flexed by the hamstring muscles. Tibial nerve runs vertically down the popliteal fossa. It gives genicular branches in the upper part, cutaneous branch in the middle part and muscular branches in the lower part of the fossa. Common peroneal nerve as it winds round the neck of fibula is the most common injured nerve in the lower limb, resulting in foot drop.